happening nationally. I do have Rachel Flum with the Economic Progress Institute around the corner.
Hi, Kate.
She's been here before. I appreciate you coming back in. You know the deal. Talking to our viewers here because you just sent out, the Economic Progress Institute sent out a letter, over 20 groups urging the Assembly to get back in to finish unfinished business from this past session. And I just want to go through what exactly you had on this list, the groups had on this list of importance that they want to see accomplished. So I'm going to go down them, but then I want to go through kind of one by one what the goals are. So disarming domestic abusers, guaranteeing earned sick days, adopting proven reforms to criminal justice, allowing workers to form co-ops, reducing toxic substances, and protecting health care. Now, I will tell you, we had Sam Bell with the Rhode Island Progressive Democrats of America. The last one was the one that he was very strident on and said that the Assembly needed to get back together. But over 20 groups. How did you even come to bring this letter? I mean, did they contact you? And you know you work with them all the time, but just said, we need to come together as a group and say these are issues of importance to us.
Sure. Well, we at the Economic Progress Institute also work heavily about what's in the state budget. And so after the budget did not pass, we were going through, we'd already had a meeting set up to talk about what was going to be in the past budget. And so when we were talking to folks about what was in the budget, what had been changed from what the governor had recommended, the overall conversation, of course, then turned to, well, what happens now that the budget was not passed? What revenue is not going to come into the state because those changes were not made? What savings is not going to occur? And then, of course, what other changes that affect families and school administrations, etc. So a number of groups said, we want to be sure that the General Assembly understands that we find this problematic. We know that the General Assembly has heard from the cities and towns about their concerns around their school administration budgets, and we wanted to be sure that the constituents' voice was heard, and a number of organizations represent different constituencies who had come up to the State House to talk about a lot of this legislation this year. We wanted to be sure that that voice was heard to say, it's not okay that you left without finishing that work, and we urge you to come back and finish the job.
And you're up there a lot. I mean, have you had conversations with the offices, with the Speaker's office, with the Senate President, or have they just been on that communications clampdown trying to figure out how to move forward?
So we haven't been up there since June 30th, and at this point we really think the important thing is coming back in to finish both the budget, which I think we're on day 25 of no budget, and also to look at that legislation again. I am reading that they met again today, but there doesn't seem to be any scheduled time to come back in. And the longer it takes, again, the more lost revenue we have, and the harder we think it'll be to have a balanced budget going forward.
So all of the issues that I just ran down, I mean, obviously they are of importance to the groups that are supporting them. What do you see has the best likelihood?
Well, I mean, most of those things on that list really were things that were almost to the finish line. The earned sick had been passed, a version had been passed out of the House, had been passed out of the Senate, and it hadn't been compromised, so there wasn't one version that was clearly going forward, but they were close. The essential health benefits one had passed out of the Senate, guaranteeing the essential health benefits even if the ACA doesn't continue. The disarming domestic abusers also, again, had looked like it was going to make it over. So, and then the workers' co-op, allowing for organizations to have a workers' co-op, all were things that had gotten very far down that list. And then the criminal justice reform package had also passed out of both sides, at least in the committees. So we really think these are all issues that were really close to being finished. I don't think there were necessarily ones that were closer than others, but it's such a wide list of organizations.
Very diverse group of organizations.
And we really thought that was important to have a broad spectrum to say this is not just the earned sick folks, this is not just the gun advocates, this is really the power of a lot of organizations trying to come together to say all of these issues matter to our constituents and we need you to come back and finish them.
Now, you sent the release out, again, over 20 groups. Are they engaging in their own advocacy effort right now, in addition to the Economic Progress Institute?
Sure, absolutely. And there were other organizations who said to us, we are doing our own individual advocacy, so we're not signing on to the letter, but we know that legislators are hearing from a lot of organizations, and we hope from constituents. We hope that people are picking up the phone and calling their individual senators and representatives and saying, urge your leadership to come back in and finish this.
So here we are in the summer. Thought maybe you'd be on break for a little bit, but still continuing to do the work. But you have other things going on at the Institute that I wanted to run down as well, especially given today with the vote down in D.C., because you've been engaging, as you said, in coalition work against the repeal of the Affordable Care Act. Talk with us a little bit about what that work has looked like until now, and sort of is it going to get ramped up now that they're going to debate?
Sure. So we, and it happens to be around the same number, over 20 organizations, came together after the threat to the Affordable Care Act came out, and also the threats to Medicaid, and have formed a coalition called the Protect Our Healthcare Coalition. People can go online to protecthealthri.org. And there are over 2,000 grassroots individuals who've joined this coalition, and really we want to do a number of things. One, to let our federal delegation know how much we support their support of the ACA and Medicaid. We're lucky here in Rhode Island, we do have a good congressional delegation, and they do get this. But our coalition can help bring individual stories to different events, so that when they're on the floor of the House or the Senate, they can bring those Rhode Island stories, and also what impact to our state budget these cuts will mean. So certainly today we're sending out messages for folks who have family members who live in other states, and some of these embattled states, who can really urge those folks to call in, to keep the phone lines open. And even, our own delegation, they find it's important to hear from folks so that they can go and say, this is a huge issue for my constituents as well. So we do think, no matter what happens with the ACA, it does look like there will continue to be threats for Medicaid. And I think this weekend is the 57th anniversary of Medicaid, so we'll be doing some work around that anniversary just to highlight what an important program Medicaid is for a number of Rhode Islanders. It's not just sort of women and children, but it's also your grandmother, making sure she can get the healthcare services she needs. It's a broad swath of Rhode Islanders. And also it is a huge support for our hospital system and our health insurance system here. So we'll continue to uplift those stories and push for maintaining them.
And here we are in July, and have you heard of are there going to be public events? I mean, we've seen so many gatherings and shows of support. As you said, the delegation is extremely receptive to the issues of importance, but do you know of any public events taking place in the coming weeks?
Well, we just did the event around when the national governors were here, when Pence came. I don't think we have another one scheduled, but we may be doing something next week around Medicaid, so we'll keep you posted.
We'll keep an eye out for that. We'll be here. And you've got other things going on as well. You were working to a webinar series about how folks can access public benefits. Talk with us a little bit about that.
Right. So we have a number of experts here in our office who really understand both the eligibility systems and how to access benefits. And so we worked with the Department of Human Services, the Executive Office of Health and Human Services, and then HealthSource RI to do a two-part webinar series, the recordings of which are now available on our website at economicprogressri.org, to really just walk through, a lot of these programs are complicated, and with the Unified Health eligibility system having some complications, we wanted to be sure that people both understood what the program requirements are and how they can access them, even during this time of transition for the commuter system. So they're fairly lengthy. They're about 2.5 hours each, but they're very comprehensive for folks who are working with clients or who have questions about problems that they've encountered and what the next steps are to overcome those.
Okay, so you can check that out and the link again.
www.economicprogressri.org.
And lastly, you just put out a release about what Trump's tax proposal could mean for Rhode Island. Talk with us a little bit about that.
Sure. So one of our national partners, the Institute for Taxation and Economic Policy, has done a in-depth study about what Trump's tax plan would mean nationally. And they also provided a look at here in Rhode Island what it would mean. His tax plan was sold during the election as being for middle income folks. But the reality of what the study shows is that the top 1% in Rhode Island would receive about an $86,000 tax cut, while about the lower 60% of Rhode Islanders would get about $400. So that $86,000 is over 1.5 times the middle income Rhode Island's income. So it's certainly, we are concerned about it for the economic inequality piece. That clearly is not a tax cut that's for everyone. And also I think it's important to remember that tax cuts do have consequences. They're not in a vacuum, that we're just allowing people to get those tax cuts, but what it will mean on the federal level is that there'll be a number of public benefit programs that will be cut to pay for the tax cuts. So, you know, the health insurance that we've been talking about, food security, education, all those things may be a direct result, be cut as a direct result.
So clearly you're keeping an eye on that, as down in DC they are eyeing healthcare right now. Obviously that's the Trump administration's plan, is to make these cost savings with healthcare and then move to tax reform. So keeping an eye on all things in DC, keeping an eye on what's going on up here. You certainly have your plate full. Is there anything we missed? I think we've covered the gamut. But again, going back to urging the Assembly to come back in.
Right. No, I mean, we really just hope that we can get to the point where we're not criticizing anyone and can just get back in and, you know, hopefully not just do the budget, but also turn to those slated bills that need to be done as well.
Very good. Are you keeping an eye on the postdocs?
We are. We have not weighed in on that at all,
Yeah.
but my 10-year-old is dying to get there. So hopefully we can get there before any big changes happen there.
Keeping an eye on all things at the Assembly, all things in DC. Rachel, I appreciate you taking the time to come in today and tell viewers what's going on at the Economic Progress Institute. Plenty, and we'll have this recapped. You can watch it later, and I'm sure we'll have you back in soon.
Great.
Okay,
Thanks so
Rachel
much, Kate.
Flum with
Take care.
Economic Progress